And what if I told you that a complex surgery could end up as a micro-incision? Would you believe it? There's a conviction that drives my entire practice. Everything can be improved. Imagine the scene. 2 maxillary canines, completely impacted, deep, intraosseous, and intimately related to the roots of adjacent teeth. Any experienced surgeon would probably think this is going to be one of those long surgeries, wide incisions, bleeding, poor visibility, and a tough post-operative recovery. And you know what? A few years ago, I would have thought exactly the same. Here's the turning point. Digital dentistry is not just a tool, it's a new way of thinking. In traditional planning, we would open a large bony window and locate the tooth in an exploratory way, guided almost exclusively by estimates. Does it work? Yes. Is it the best way to do it? Definitely not. That's when I shifted into a virtual environment, connecting diagnosis to planning in a more strategic way. First, I simulated a palatal approach and digitally removed the crown. What did I discover? The root was even higher than it looked, locked in a deeper region, and I wouldn't have direct visualization or access to the apex. A buccal approach alone wouldn't solve it either. The crown would remain trapped between the roots of the neighboring teeth. At that moment, the digital mindset opened a new possibility. Instead of a second wide incision, we designed a surgical guide printed in biocompatible resin, taking me exactly to the necessary point with millimetric precision. And we didn't stop there. We also created an incision guide to lead me straight to the target area. And the result? A micro-incision. And when I say micro, I mean just a few millimeters, made with electrocautery, with minimal bleeding and total control of the surgery. I positioned the guide, and the osteotomy was surgical in the most literal sense of the word. Precise, minimal, and respectful of all neighboring structures. And you know what the patient asked me at the end? Doctor, is the surgery already over? That's the power of digital dentistry. When you simulate before touching the patient, when you create pathways instead of following old templates, you're not just performing a surgery, you're delivering precision, predictability, and real benefits directly to the patient. Don't treat digital dentistry as just another tool in the office. Treat it as a new way to see your cases, your patients, and your profession. But remember, as important as practicing evidence-based dentistry is questioning the dentistry we already know. Evolution always starts with a question, and it's through critical thinking that we break established paradigms, bringing benefits to the surgeon and above all to our patients. See you in the next video.